Hello, it's Danny Greaves here, and a big thank you to you for taking the Trauma Resolution Scorecard. And I'm going to assume that if you've reached this stage, you've probably invested lots of time and energy and probably lots of money in working on your own personal development, maybe through therapy, maybe through alternative means, but you haven't got the result that you're looking for yet. And so, in this short presentation, I'm going to keep it less than 15 minutes. I want to explain why those other approaches might have failed you so far and how the neuroscience is showing us a new approach that is a better way. So, in terms of our aims, we're just going to have a look at the big picture because that sets the context. Then we're going to have a look at the micro moments that might be called adverse or traumatic experiences. We're going to have a look at the pros and cons of talking therapy, and then a couple of practical examples. So if we look at the macro, so the big picture, we can divide all human beings into three fundamental needs. We have a need for safety, so survival, we have a need for belonging, and we have a need for love. Now, because of the experiences and the events that we go through growing up, we make certain judgments on, for us, what is missing. And those judgments about what is missing, we call your voids, like the gaps that prevent you from being fulfilled. Those voids drive your values, and your values determine all of the behaviors and choices you make because it's the most effective way to get you fulfilled by doing the things that are most meaningful to you because they fulfill those voids. Now, we don't see the world as it is, we see it filtered through our own unique set of values. So when we have a challenging event that's difficult or painful for us, we make negative judgments and we create negative emotional charges. This then gets stored as emotional baggage, which gets stored subconsciously. That then turns into a trigger, which makes our system hypervigilant to make sure we don't come into contact with a threat similar to that. And then, because of how the brain works, in particular the predictive coding model, our brain uses data from the past to inform likely future experiences. So the more pain we have in our past, the more pain we predict in the future, and that then leads to brain noise, overthinking, overwhelm, and anxiety. So that's the big picture. Now, the micro picture is even more interesting because out of those three fundamental needs, safety is paramount because that equates to survival, and first and foremost, the priority of the brain is survival. Now, when we come into the world, we all have what's called innate auto appraisers. And this is an unconscious and automatic danger detection system that all human beings come into the world with. So that's why we all share many of the same fears in terms of spiders or snakes, because from an evolutionary perspective, those are hardwired into our system. So we develop them much, much more quickly. But the beauty of being a human being is that that danger detection system is open. So we can learn new danger triggers based on experiences that are threatening to us. So when we have an intense event, so have an event where you feel emotionally overwhelmed or it's really painful, it's traumatic, your nervous system perceives that as a danger to your survival. Now, it's important to note here what's overwhelming for a 4-year-old is going to be very different to what's overwhelming to a 44-year-old. So, as the 4-year-old might feel overwhelmed when their caregiver shouts at them, if we think about from a survival perspective, we're completely dependent on our caregivers. So, if one of them goes in a rage towards us, that is a danger to survival because if our caregivers don't protect us, we will die. So that's relative to every single individual based on values and also based on age. So when we have one of those experiences where our nervous system perceives a threat to our survival, and again, that won't be a conscious question that you ask yourself, but your nervous system will process and evaluate. As a safety mechanism, your mind takes a snapshot of where you are, who you're with, what's happening, and what it feels like, and it stores all of this in what's called an emotional memory image. This emotional memory image is then added to that database of other threats. And once it's added to the database, it then becomes an unconscious, involuntary reaction. So it becomes a trigger that again happens before your conscious awareness. So, anytime your nervous system perceives something that is similar to or even symbolic of that original early experience, that threat to survival, it triggers an echo of the same threat response, hopefully to get you to either survive it again or to take different action. Now, if we think about how talking therapy works and just talk about the fundamentals of it, it's cognitive in nature. Yeah, so it's thinking by its very name, cognitive behavioral therapy, for example. So it's a thinking based process. It helps us to learn the interrelationship of our thoughts and beliefs with feelings and behaviors. We can learn and explore our past narratives about ourselves, our past scripts, our past beliefs. We can understand how, when, and why those dangers were added to our database. We understand why the trigger forms. And we then get taught cognitive or embodied tools and techniques to help lessen and mitigate the reactions that we have. That then leads to better coping skills and more resilience. So there's kind of a simple framework of the talking therapy. But based on what we've covered so far, we can see there are some pretty glaring faults with that approach, particularly when it relates to early experiences or traumatic experiences, because we're attempting to apply a cognitive thinking approach to a hardwired, automatic, evolutionary adapted survival system. Now, to put this into context, it's estimated that we've had cognitive faculties for around 195,000 years, and emotion has been hardwired into us and our ancestors for around 10 million years. So there's not night and day between the two processes. So, trying to use the cognitive approach to manage the hardwired automatic emotional one is going to be a huge challenge. Because of its nature, it's cognitive, it necessitates the sharing of personal, sensitive, and painful stories, which can be really difficult and embarrassing and really uncomfortable. The application of many of the techniques occurs after the trigger has been initiated. So, therefore, you're trying to lessen the effects rather than resolve the root. And sometimes that just will not work because if your system perceives a threat to your survival, the cognitive system is shut down, blood glucose and oxygen moves to the primitive centers, and you make more fight, flight, freeze responses because your emotions kick in. Now, talking therapy also requires intensive, prolonged effort. It's often a very ongoing process that can take months or even years to get improvements. And because of this, applying a cognitive faculty to a hardwired, evolutionary adapted emotional system, you're always fighting an uphill battle. So it can feel really, really exhausting, really, really energy intensive, and you probably won't get the outcome that your work and your effort would really deserve just because of a mismatch in the systems. If we go to the NHS website this year, so 2024, while CBT addresses current problems and focuses on specific issues, it does not address the possible underlying causes of mental health conditions such as an unhappy childhood. So on the website, it actually tells us that it's not designed to resolve those early experiences. It's not designed to resolve those early triggers. It's designed to help you cope with current issues. So if they're related to childhood, then there's already that separation there. If we look at what talking therapy is brilliant for and what it's really, really helpful for, when we have personal challenges that would be considered a lesser threat in terms of it's been scanned by our auto appraisers and our system has determined it's not a threat to our survival. So this excludes traumas, adverse experiences, moments of overwhelm, moments of intense threat. It excludes all of those. But for lesser threats, maybe around relationship challenges or career pathways or elements that are around our cognitive challenges as an adult, the conscious mind has more room to engage, and more importantly, it has more permission to engage because the emotional system will let the cognitive join in, for want of a better phrase. This then means we can explore thoughts, beliefs, feelings, and behaviors, which can then lead to greater learning, understanding, and growth, and therefore we develop as a human. So, what if we could actually clear and resolve those learned danger triggers from those adverse, painful, or traumatic experiences? What if we could process and integrate the emotional memory images to clear them from the database to allow your nervous system to respond in the moment rather than react to the past? Well, there is plenty of research that shows we can. And it's a different approach. It's a non-verbal approach. It's the approach I specialize in. But we've got a split second unlearning model, definition of attributes of emotional memory images, perspectives on emotional memory images and pain, hidden family rules, and how paternalistic systems lead to mind-body challenges, how family relationships lead to dysfunctional setups. So the research and the neuroscience is already there, but it's just not common access. So, to give you a couple of examples, people pleasing is a really, really common challenge that people come to see me for. If, for example, during your formative years, you had an experience with a caregiver where they went into a rage, they were really angry at you, or they were just angry and you were there, which is often the case because they might have had their own stuff going on, your system immediately perceives caregiver anger, which means it's a threat to your survival because you're completely dependent on them. So if they're angry at you, your system knows that they're 2 or 3 times bigger, they're faster, they're stronger. So we've got a threat to survival. Your system takes a snapshot, pairs anger with danger to survival. So then, as you grow up and now you're an adult, anytime there's the possibility of someone disagreeing or there being a confrontation or someone getting angry, fear response is triggered, activated, so you get the fight or flight response, and it's easier and safer from your system's perspective to people please rather than stand up for what you want. Another common reason people come to see me, being able to express themselves authentically. So, if during your early years you were able to have the courage and the bravery to express yourself in some way, shape, or form, but that was met by a caregiver's punishment, criticism, or even ridicule, again, your system associates self expression with threat to survival. Emotional memory image is generated, added to the database. Now, when you're 34 years old, you're 54 years old, anytime a moment arrives where you might express yourself, fear response is activated, your mind goes blank, you feel overwhelmed, you can't think, you can't remember your words, your system goes into panic because self expression has been paired with danger. And just one more, if we think about complex family dynamics, we've got those fundamental human needs in terms of love and belonging. So, as a evolutionary perspective, we are dependent on the tribe for survival because we have to live in groups. So, if we're not getting that sense of belonging or love from our primary caregivers, that's equivalent to being cast out from the tribe. Then we've got another threat to survival. This means that the emotional memory image is generated, and this often leads to lots of challenges around rejection, which then has huge implications for personal relationships, professional progress, because your safety system kicks in and then you freeze or fall. So, I hope this is a whistle stop tour to help you really realize that all the effort that you've put in so far has got you to this point. But if you really want to clear those triggers from the database, we're going to need a different approach. It's the approach I specialize in. I would love to help you if it's a good fit. So please book a call with me or get in touch, and I'll speak to you soon. Take care.